Hello, everyone. What if I told you that one injection could work for an entire month, or even longer? No daily tablets, no missed doses, just one shot. And the drug keeps working slowly in your body. Sounds perfect, right? Well, not always. Today, I will discuss depot drug administration. Depot drug administration is a method in which a drug is administered so that it is stored at the site of injection and released slowly over a prolonged period of time. The most commonly used route for depot preparations is the intramuscular route, though in some cases the subcutaneous route may also be used. Depot drugs are usually formulated as oily solutions, aqueous suspensions, or biodegradable implants. After injection, the drug forms a depot or reservoir in the muscle tissue. Due to the moderate blood flow at the injection site, the drug is absorbed gradually, producing a sustained and prolonged therapeutic effect. This method helps maintain steady plasma drug levels, reduces the frequency of dosing, and improves patient compliance, especially in patients requiring long-term treatment. Common examples of depot drugs include penicillin, G-benzathine, medroxyprogesterone acetate, haloperidol decanoate, and fluphenazine decanoate. Now let's understand the pros and cons of depot drug administration. Let's see the pros. 1. Prolonged duration of action. Depot drugs are released slowly. That means long-lasting therapeutic effects without frequent dosing. For example, some antipsychotic depot injections are given once every 2 to 4 weeks. Reduced dosing frequency, no daily tablets, no forgetting medication. This makes life easier for patients, especially in long-term therapy. Better patient compliance. This is a huge advantage in psychiatric conditions like schizophrenia. Even if the patient forgets or refuses oral medicine, the depot injection ensures continuous treatment. Compliance improves dramatically. Stable plasma drug levels. Because the drug releases gradually, blood levels remain relatively stable. This reduces peak-related side effects, sudden drop in drug levels. Less fluctuation means better therapeutic control. Useful in chronic conditions. Depot formulations are ideal for long-term therapy, such as antipsychotics, haloperidol decanoate, hormonal contraception, medroxyprogesterone acetate, long-acting antibiotics, benzathine penicillins. Avoids first-pass metabolism. Since it's given intramuscularly, the drug bypasses the liver's first-pass metabolism. This can improve bioavailability compared to some oral drugs. Now here's where we need to be careful. Irreversible. Once the depot injection is given, it cannot be removed. If the patient develops a serious side effect, we can't simply stop the drug immediately. Prolonged adverse effects. Because the drug is long-acting, any side effects may last for days or weeks. This is one of the biggest clinical concerns. Injection site problems, pain, swelling, irritation. Repeated injections may even cause local tissue damage. Requires trained personnel. Unlike tablets, depot injections must be given by healthcare professionals under sterile conditions. So, it's less convenient. Risk of infection. Improper aseptic technique can lead to abscess or infection. Proper administration is critical. Not for emergencies. Depot drugs have a slow onset of action. In emergencies, we prefer rapid routes like intravenous administration. In conclusion, depot drug administration is an effective method for achieving long-lasting drug action, better compliance, and controlled drug release, making it an important part of modern pharmacotherapy. If you found this explanation helpful, please like the video, subscribe for more pharmacology topics. Thank you.